Hello viewers and welcome once again to Healthy Wrinkles channel, a channel devoted for healthcare of senior citizens. I'm happy to have once again Dr. Balaji Jaganmohan. Doctor, today we are going to discuss hypoglycemia and especially in the context of elderly or senior citizens. So my first question, doctor, is what is hypoglycemia in the first place?
Yeah, so good evening or welcome to all the viewers. Thank you, Mr. Shihari, for having invited me again. So hypoglycemia is basically a state where the blood sugars are falling below a certain range. And that is why they are termed as hypoglycemia or low sugar. So this range has been set by all the international guidelines as 70 milligram per deciliter. And once the blood sugars will come to around 55 milligram per deciliter, that is when the body's defense mechanism will kick in. So there are certain counter-regulatory hormones like glucagon, like epinephrine, cortisol, growth hormone. So these ones will be released, which will then try to elicit certain symptoms. So at that point of time at 55, it's mostly the hormone called epinephrine, which elicits an adrenergic symptom response, which is like giddiness, feeling hungry, the hands and legs will start shaking, you start sweating a lot, you can have stammering while speaking. So there are certain warning signs at this level of 55 and below when a person's body is kind of indicating him to take some action to correct the low sugar. And once it goes below 30, then that is like a very dangerous sign or a dangerous level of blood sugars where they can even directly go into coma, or what we call as neuroglycopenic symptom, where they can even fall unconscious and they require maybe a third party assistance. Now, to actually talk about hypoglycemia, there is something called Whipple's triad. Whipple's triad has beautifully explained hypoglycemia, which I think most of us as practicing physicians tend to ask our patients if they have any of these symptoms or measures of Whipple's triad. So what is this Whipple's triad? So one is the patient has symptoms suggestive of hypoglycemia. So which means that it has gone below 55 and he has any of the symptoms, which the patient will reveal to the treating physician. And then the second one is basically documentation of this blood sugar on a glucometer. So if there is a self-monitoring and if they can check that, that again will indicate whether the blood sugar has come down. And the third one is basically correction after consumption of an oral carbohydrate intake, which means if they eat something that contains glucose, then immediately the blood sugars will, start to rise. So this Whipple's triad mostly has to be present in order to label someone as having hypoglycemia. Now, within this triad, I have seen in my practice many patients, they might have the symptoms, but they have not checked the blood sugar. They only eat something and immediately they feel better. So any one or two of the symptoms also is indicated that they have hypoglycemia. If all three are there, then it's easier for us. Sometimes they don't have the symptom, they only check and then they eat something, or they check or they don't eat. Automatically, maybe it's lunchtime, they eat something and it's automatically corrected. But Whipple's triad is something that is useful in order to label someone as having, hypoglycemia.
Understood, doctor. And doctor, my next question is why hypoglycemia? One has to, really more cautious or take a lot more precautions while treating if it is elderly versus a younger adult.
Yeah, so the elderly as such, are more likely to have some of the complications related to hypoglycemia. Because elderly, what happens, most elderly patients are generally long-standing diabetics, and they might be on multiple OHAs, they might be on insulin, they might even be on sulfonylureas. Many of them might even have hepatic impairment, renal impairment. And there are also two conditions, what we call as hypoglycemia unawareness or hypoglycemia associated autonomic failure. So in that, what happens, there are elderly people who do not have the symptoms of hypoglycemia at that range of 54. So 54 is a warning sign when normally people will have symptoms, but here they do not have these symptoms. It is bypassed and they directly go into the neuroglycopenic stage where they might fall unconscious. So that is why it is very important for elderly people to first of all identify the comorbid conditions that are coexisting in them. Then accordingly we can take measures, give them the suggestive advice in order to prevent and avoid hypoglycemia. In such cases where we know that they are prone to hypoglycemia unawareness, or they might have hepatic or renal impairment, we might even relax the glycemic control. So we might maintain the HbA1c 7 to 8% or even above 8% in some instances, because hypoglycemia can be more lethal than hyperglycemia. In fact, many studies have shown that hypoglycemia in the immediate period can trigger arrhythmia. So if it triggers a arrhythmia, then it can immediately go into a cardiovascular death. So the person can die because of that. They can even go into cognitive impairment. They can go into coma, where they might have to be hospitalized, and recovery from coma can take many days, or they might not even recover. So hypoglycemia as such in an elderly can be more lethal. And if there are individuals who are more susceptible to hypoglycemia, it's better to avoid it by trying to relax the glycemic control.
Yeah, so I think that is important point doctor made, that maybe tighter glycemic control, maybe you might relax a bit when it comes to senior citizens. One of the area that you mentioned is the cognitive functioning might get impacted. Are there any other body systems or organs also, doctor, get impacted if it is a repeated or long-term hypoglycemia issue or challenge?
So hypoglycemia generally will only affect the brain functioning, because if the glucose supply to the brain is interrupted, then they might run the risk of a short-term memory loss. Or repeated hypoglycemias, there are some articles which can even heighten or increase the risk of dementia or worsen dementia. And the heart, of course, the heart is another system. Very commonly it can trigger an arrhythmia and lead to CV death. Apart from that, there are a lot of studies, a lot of evidence that has emerged of late, that glycemic variability, particularly with fluctuations, hypoglycemias, can lead to worsening of some of the diabetes related complications. So for example, a retinopathy can worsen, a nephropathy can worsen, a neuropathy can become more severe, and the patient's pain might worsen. And also, if patient has got peripheral arterial disease, the risk of stroke or a myocardial infarction can worsen. And there is new data to substantiate that.
Okay, yeah. Doctor, my last question is like, someone in the family, if is managing elderly or senior citizen having diabetes, what kind of, signs, symptoms one should be, looking for, or at least should be aware that, if something of this nature is seen, I think there could be medical emergency. So what are those signs, symptoms you would recommend to be looked for or to be watched?
Yeah, so it's very, very important that the patient caregiver, so whether the relative of the patient attender, or the guardian of the patient, has to be wary of hypoglycemia, particularly if the patient is elderly and they're taking insulin or they're taking sulfonylurea containing drugs. So we generally try to educate them. We have certain leaflets that have information about hypoglycemia with pictorial depictions, which talks about the different symptoms. So it's easy for them to correlate if they're able to see the images. And so that is one, to explain to them what are the symptoms. Secondly, we have to tell them about the corrective measures and checking the blood sugars. Now, what happens many a times in an elderly, suppose in case they fall unconscious, then it is not advisable for the caregiver to give anything orally, because what will happen if they're if they're unconscious, they might aspirate the, if it's a liquid particularly containing any glucose, and then that can lead to pneumonia or aspiration related side effects. But if they are conscious and they complain of any of the symptoms of hypoglycemia, then immediately after checking on the glucometer, even if they cannot check, if they feel the symptoms are matched with whatever has been explained in the clinic, then they can give them something orally. We also tell them that it is important for the caregiver to ensure that the elderly person has some carbohydrate with them in their pocket wherever they're going. Can be a candy. We generally tell them to avoid chocolates, because chocolates also have a fat content. So it will take a longer time for the blood sugars of that person to come to normal. Anything which is a direct sugar, ideally a liquid drink, so a small mango juice or any form of apple drink, that is much better if the patient has it with them. And we also tell them that it's important that the patient has a card stating that he or she is a diabetic and stating that they might get hypoglycemia and they might fall unconscious. So just in case they've gone out, somewhere in the city, and just in case they've not eaten and they've exercised more, they've taken too much of insulin, if they fall unconscious, at least someone in that card would know that he's a diabetic, he has hypoglycemia, and they can take them to the nearby hospital so that immediate measures can be taken for that patient.
Thank you, doctor, for highlighting these issues, because I think very important, simple but very important tips for managing hypoglycemia episodes in elderly, or senior citizens. Thanks once again, doctor, for joining this conversation, and I'm sure viewers will find it very, very relevant and useful, doctor.
Thank you so much. Thank you for inviting me. See you.